Good morning, everyone. First, I'd just like to say a massive thank you to everyone attending. I know how busy you are, and I'm grateful for you taking time out of your busy schedule to listen to me talking about my project. I hope you enjoy my presentation. It should take around 30 minutes. Please leave any questions until the end or put them in the chat section of Teams. To set the scene, my research is concerned with the relationship between ventilation practices, indoor air quality, noise and overheating, and their impact on health. My presentation is split into 5 sections. I'll begin by giving some contextual background information, summarise some of the key literature, and discuss the important research gaps. I'll then discuss the aim and research question of this project, followed by the methods, and moving on to describing a novel method I have developed for inferring window positions from sound measurements, and finally discussing my work plan for this project. During the introduction and background section, I'll firstly describe the relationship between indoor environmental quality and health, then the relationship between indoor environmental quality and ventilation, and finishing off the background section with the relationship between occupant behaviour, ventilation and indoor environmental quality. So to begin with, some context. On average, we spend 95% of our time indoors. Adults with young children, the elderly and unemployed are likely to spend much more time indoors than the average person. More recently, during the COVID-19 pandemic and national lockdowns, we're spending more time indoors than ever before. The indoor environment is comprised of 4 component parts: thermal environment, acoustic environment, visual environment, and air quality. Whilst we spend time indoors, we're exposed to these components, and these components have the potential to affect our health and well-being. First, I'll discuss the thermal environment, where exposure to high and low temperatures can affect our health. Low temperatures affect the human body's cardiovascular and respiratory systems and can lead to death in humans. There are an estimated 41,000 excess winter deaths in the UK during 2014. And these excess winter deaths are expected to reduce by 2% by 2050 due to the effects of climate change. Exposure to high temperatures can cause heat stress, heat strain and heat stroke. There were an estimated 2,000 deaths due to exposure to high temperatures in the UK during 2014, and these are estimated to rise by 257% by 2050, again due to the effects of climate change. Indoor air quality is a broad term and encompasses chemical and particulate pollutants that are present in the indoor air. Exposure to air pollutants can result in a wide range of health and well-being issues in humans, but the main health issues are to the cardiovascular and respiratory systems. Some components of indoor air quality can also have an indirect impact on our health. For example, humidity can affect mold growth, and mold can impact the human respiratory system. There are an estimated 3.8 million deaths every year around the world due to indoor air pollutants, 99,000 of which are in Europe. Exposure to particulate matter is the leading risk factor for burden of disease in Europe. Exposure to noise can affect health and well-being in many different and complex ways. Annoyance and sleep disturbance have the strongest evidence for effects of noise on health, where this can result in fatigue, reduced performance, cardiovascular illness, and mental health issues. Noise is the second leading risk factor for burden of disease in Europe after particulate matter. Ventilation can be defined as the removal of stale, polluted or warm air from inside and replacing this with fresh, unpolluted or cooler air from outside. In the UK and Europe, natural ventilation is the dominant form of ventilation, comprising of trickle vents, extract fans in the bathrooms and kitchens, and by opening windows. Trickle vents provide whole dwelling background ventilation, which is a constant low rate ventilation for managing indoor air quality. We have intermittent extract fans in our bathrooms and kitchens, which control odour and moisture generation from cooking and bathing. And we have purge ventilation by opening our windows to control air quality during occasional activities such as painting, decorating, or the accidental release of smoke or water. There's general agreement between the theory, modelling studies, and the limited empirical research considering the relationship between ventilation and overheating. These studies generally show that when the outdoor air temperature is lower than the indoor temperature, high air exchange rates will reduce the indoor temperature and reduce the risk of overheating. Not all empirical research has found this relationship, as it is often difficult to disentangle the cause and effect of overheating. Modelling by Taylor et al. Illustrated the interdependent relationship between overheating, indoor air quality, outdoor air quality, and ventilation. When ventilation was shown to reduce overheating and indoor concentrations of pollutants from indoor sources, but increase the indoor concentration of pollutants from outdoor sources. This is important as it highlights that occupants that choose to open their windows in an effort to reduce overheating might inadvertently increase the concentration of pollutants from outdoor sources. There is limited empirical research considering overheating in the UK and a lack of research considering the relationship between occupant behaviour and building overheating. The current empirical research lacks measurements of air exchange rates, has small sample sizes, and lacks measurements of other aspects of the indoor environment. Furthermore, typically overheating is considered in isolation from all of the other aspects of the indoor environment. The literature describes that when there is an air exchange set up between indoors and outdoors, for example when opening windows or operating ventilation systems, indoor concentrations of pollutants from indoor sources such as carbon dioxide and volatile organic compounds will be reduced by dilution or removal. However, indoor concentrations of outdoor pollutants such as particulate matter and nitrogen dioxide will increase. Conversely, occupants might not want to open their windows due to noise, air pollution, security, or for many other reasons. In this case, low air exchange rates will result in higher concentrations of pollutants from indoor sources and lower concentrations of pollutants from outdoor sources. Closing the windows can also cause overheating, as previously discussed. The relationship between ventilation and pollutants from different sources was demonstrated through modelling of particulate matter by Taylor et al. And empirical monitoring of nitrogen dioxide by Dimitropoulos et al. Both found higher indoor concentrations of pollutants from outdoor sources in dwellings with higher air exchange rates when compared with dwellings with lower air exchange rates. Dwellings with lower air exchange rates had higher concentrations of pollutants from indoor sources. Noise can be generated by ventilation equipment, and this is a common reason for occupants disabling, blocking, or turning ventilation systems off. Turning off purpose-provided ventilation systems can compromise the thermal and air quality of the indoor environment, allowing temperatures and pollutants from indoor sources to rise to potentially dangerous levels. Outdoor environmental noise is regularly cited as a barrier to occupants opening their windows in pursuit of improving indoor air quality or reducing overheating. This is shown through a large research project by Anderson et al. Of 933 participants, which found environmental noise to be a significant predictor of when a window was open. They also found that in dwellings that perceived the indoor air quality as bad, more windows were opened in dwellings that perceived the environmental noise as quiet. This is important as it shows that despite poor indoor air quality, occupants did not have open windows, which could be due to the fact that they perceived the outdoor environment as noisy. Most of the literature reports that occupant behaviour is one of the most important factors for ventilation, air exchange rates, and overall indoor environmental quality. This is shown through research by Becker et al., where different regression models were constructed based on measurements in 500 Danish bedrooms. This research found that occupant behaviour was a far stronger predictor of ventilation rate than building characteristics alone. The authors built different regression models with building characteristics and behavioural variables and found that the behavioural model was able to describe 30% of the variation in their air exchange rates, and the building characteristics only 9%. The reasons why people open their windows and the barriers to opening their windows are vast, and research frequently describes that ventilation behaviour is very different between people. Some people ventilate when carrying out specific activity, such as showering or cooking, others at specific times of the day. Others react to the perception of temperature or air quality. Ventilation is also shown to be influenced by the type or use of the room, building design, occupant knowledge of ventilation, and the operation of their own ventilation systems, noise from the ventilation, noise outdoors, security, outdoor air quality, household size, occupant age. This large number of driving factors and barriers make ventilation research complex and challenging. Despite the literature emphasising the importance of occupant behaviour on ventilation and indoor environmental quality, there is a lack of empirical evidence and research on the relationship between occupant behaviour and indoor environmental quality. There are a number of key gaps in the literature. There is a lack of empirical evidence of overheating and the relationship between occupant behaviour and overheating. This has been mentioned by a number of different sources in the literature. Fabi et al. Described that there is also a lack of understanding in the relationship between indoor air quality and the ventilation behaviour of occupants. ACOM described that there is a gap in our understanding of the response of occupants to noise and the effects of this response on indoor environmental quality. Finally, from a holistic perspective, Mavrogiani et al. Described that the different component parts of indoor environmental quality are usually examined in isolation, and the synergistic effects between occupant behaviour and indoor environmental quality has been under-investigated to date. To summarise, there is a gap in the literature in the relationship between the interdependent indoor environmental quality factors and ventilation. Leading on from the literature review and research gaps, the aim of this research is to investigate the relationship between occupant ventilation practices and indoor environmental quality factors, including overheating, indoor air quality and noise, and relate this to health thresholds and guidance. The main research question of this project is: how do ventilation practices and air exchange rates relate to indoor environmental quality in dwellings exposed to high levels of outdoor air pollution and environmental noise as outdoor conditions vary? This research aims to study the relationship between indoor environmental quality and ventilation using an empirical approach which responds to the lack of empirical data on indoor environmental quality. Modelling would also not be able to answer the research question of how real people behave in a real setting. Next, this research will employ mixed methods, collecting both quantitative physical measurements of the indoor environment and qualitative social data on the household and their ventilation practices. A mixed methods approach is important as the buildings are considered as complex socio-technical systems, and much of the ventilation behaviour we're interested in is enacted by the occupants. So it's important to collect data from the occupants on their reasons for ventilating. More details to follow on the coming slides. Finally, I'll study this phenomenon using a multi-case study approach where I can carefully explore the complex interaction of all the factors previously discussed. Case study research allows the researcher to explore cases in great detail within its real-life context, and Flippe argues that case study research enables the researcher to develop a nuanced view of reality. During March last year, I had the support of Oxford City Council to recruit from tenants of a specific area that had noise and air quality concerns However, the pandemic meant that they were unable to support the project, so I carried out recruitment from within UCL and Public Health England at the end of last year. I carried out a multi-criterion decision analysis for all respondents, which allowed me to shortlist and select 4 participants. The MCDA was based on the suitability for the monitoring campaign and other features such as noise and outdoor air quality. Some of the sample are students and some are public health professionals, so there might be some expert knowledge of ventilation, the indoor environment, and how this impacts health. One of the methods I'll be employing is a technical building survey. I'll hopefully be carrying this out later this year. The image on the right hand side is a copy of the survey I carried out during my MRes. The information I aim to collect during this survey will include the layout of the dwelling, measurements of the rooms, information on ventilation systems and windows, sources of heat, air pollutants and noise, details of adjoining properties, and finally information on the materials that were used to construct each of the dwellings. I'm using a range of specialist equipment for collecting data on indoor environmental quality. I'm measuring temperature, humidity, carbon monoxide, carbon dioxide, nitrogen dioxide, PM1, PM2.5, PM10, total volatile organic compounds, and noise inside and outside of all dwellings. I'm also measuring when any window or door is open or closed. The noise equipment that we're using was developed by Ben Finnick and myself, which is based on a Raspberry Pi small computer with 2 microphones. This equipment was used in developing a novel method for inferring window positions, which I'll discuss later in this presentation. These devices deconstruct the indoor and outdoor sound signals in real time into the spectral components. So it doesn't store audio files, only 5-minute average third octave frequency data in numerical form. Ethical considerations were key in developing this equipment and indeed featured heavily in the ethics application for this project. The variables I'm measuring are the aspects that are known to impact health, and I'm measuring the most important indoor environment variables for health. There are of course others. COVID presented unique challenges to the monitoring campaign. Normally I'd install the equipment myself, but this was not possible due to COVID. During November and December of last year, I modified all of the equipment and tested it so that it could be pre-configured, disinfected, packaged and couriered to all participants for them to install themselves. The equipment was sent to participants in January. They quarantined the equipment before installing it using detailed installation instructions I produced and video calls and WhatsApp messages. The literature review highlighted that occupant ventilation behaviour has the biggest impact on the indoor environment. It is therefore important to try and understand the reason for this ventilation behaviour if we were to understand the interaction between humans and the buildings as part of the complex socio-technical system described by Lowe et al. The questionnaire was developed based on the factors identified in the literature review as important for ventilation and the indoor environment. Similar or the same questions were used from other research in this area to facilitate insights across this and the other research projects. The questionnaire was trialled and refined based on feedback, and the final questionnaire was issued using an electronic platform to all participants in January 2021. Which was just before the start of the main technical monitoring campaign. This slide summarises the methods and how these methods aim to answer my research question. I'm currently working on my analysis plan, so this is an initial view of my work in progress analysis plan. The literature reports that ventilation behaviour is highly seasonal and also dependent on outdoor temperature. So I'll look at the relationship between ventilation and indoor environmental quality during the different seasons and during different outdoor temperatures. During the different seasons, I'll look at the relationship between ventilation and indoor environmental quality. I'll determine when the dwellings are occupied and calculate air exchange rates from CO2 decays using the method developed by Few and Elwell. To investigate these relationships, I will employ a range of statistical tools, which will likely involve regression, relationships in distributions, and threshold analysis. I'm yet to determine exactly which tools I'm going to use. I'm also considering different ways of evaluating indoor environmental quality, and one method I'm considering was developed by Larson et al., which considers indoor environmental quality as both components and also as a composite. Other analysis of the technical data will involve calculating pollutant exposures and correlating these exposures with air exchange rates, comparing air exchange rates and exposures with recognized thresholds, and also plan to look at potential relationships and correlations between indoor environmental quality components. Next, I'm interested in the social component of ventilation. I'll use my questionnaire for both contextual information and also to relate to ventilation behavior. I'll code my questionnaire and look for relationships and correspond the phenomena I see in both the qualitative and quantitative data. For example, some of the questions I can consider between quantitative and qualitative data are: do people ventilate when they say they do? Or do occupant perceptions of the indoor environment align with the measurements of the indoor environment? This concludes the description of the methods and analysis I will use in my project. In this next section of my seminar, I will describe a significant piece of work that I've carried out over the past year. This is a novel method of inferring window positions from sound data. I'm currently writing this up and hope to submit to a journal for publication in the coming month or two. A bit of background. Researchers typically record window opening and closing by using occupant diaries, observation by researchers, or more recently by using electronic reed switch loggers. Diaries and observations are labour intensive and can suffer from low temporal resolution and inaccuracies. However, electronic reed switches can also be intrusive and not always found to be acceptable to occupants. They are expensive, can be unreliable, and importantly, they're not able to differentiate between different window positions. They only really measure closed and open window positions. For these reasons, I developed a method to predict if a window is open, ajar, or closed by using a statistical model which has been trained using the differences in third octave frequency sound data collected inside and outside of a window. An overview of the method is shown below. Step 1, calibrate and install the equipment and survey the installation setting. Step 2, with the equipment logging, we change the window position and record the times and window positions over a set training period. The noise data and the window position form the training data. Step 3, we collect the test data over the extended monitoring period. Step 4, we ingest, clean and pre-process the data. Step 5 is to train a statistical model using the training data. And step 6 is to use the model from step 5 to predict the window positions in the test data we collected in step 3. This method was applied to 2 case study dwellings, one a semi-rural setting and another in central London. In both case studies, noise was measured inside and outside of a window using a number of different metrics. In the semi-rural case study, a specialist class 1 instrument was used to measure the noise inside and outside of the window simultaneously. But in the London dwelling, Ben Fennick of Public Health England and I developed a novel noise measurement platform based on the Raspberry Pi small computer. This device measures sound inside and outside of a window simultaneously and processes the sound into its spectral components and stores this data, which we retrieve by GPRS. The campaign was run for 9 days in the semi-rural dwelling and 3 months in the urban dwelling. The graph on the right-hand side shows the noise difference between inside and outside of the window in the semi-rural case study. The top part is the noise difference using an A-weighted scale, and the graph below is the window positions where 0 is closed, 1 is ajar and 2 is open. These graphs together illustrate that when the window is closed, the noise difference is greatest, followed by the ajar position, and finally when the window is open, the noise difference is the smallest. I trained 6 models for each case study using linear and multinomial logistic regression. I used 3 sets of data for each model. The first one was using all of the third octave frequency data. The second set was using frequencies, third octave frequencies below 1 kHz. And finally, using the top 10 frequencies identified by sequential forward feature selection. The training data for both case studies comprised the first 20% of the data, and the table below shows a summary of the accuracies of the 6 models I created for each case study. For both case studies, the logistic models that were trained with the top 10 frequencies identified by sequential forward feature selection are the most accurate. Detailed analysis shows that the lower accuracies in the semi-rural dwelling were attributed to the fact that there were a large number of ajar positions recorded in this case study, and the models have the greatest difficulty in differentiating between the ajar and closed positions. In the urban dwelling, by comparison, there were not many ajar positions recorded, so the model was more accurate in differentiating between the open and closed positions. To conclude, this method provides an accurate way to infer window positions from sound measurements taken inside and outside of a window or door. This allows intermediate or ajar window positions to be inferred where other methods are unable to do so. It also provides an effective alternative to electronic reed switch based sensors where sound is already being measured. Finally, I'll wrap up my presentation by summarising the work I've done to date and the work that remains to be done over the coming 2 years or so. I've successfully carried out a pilot study employing all of the equipment for the main monitoring campaign in a single case study flat during 2019. I'm currently co-authoring a paper on HVAC optimization which used the data I collected during this pilot study. I've had my original and revised ethics applications approved. The revised applications included numerous COVID-19 specific measures. My risk assessment has been approved, again with a number of COVID-19 specific measures. The noise equipment was designed, developed, built and calibrated, along with the preparation and calibration of all the other technical equipment. I completed recruitment for dwellings, issued the questionnaires, and despite the challenges around COVID-19, I was able to set up and initiate the technical monitoring campaign entirely remotely. This campaign will run for a total of 9 months, ending around September this year, after which I will uninstall the equipment and carry out post-monitoring cross-calibration for all the equipment. I hope to carry out the building surveys later this year, subject to the restrictions around COVID. I'm currently working on my data analysis plan and the Python code I'll use to analyze the data, which I'm working on at the moment and will probably do so for around the next 4 or 5 months. I'll analyze parts of the data when I'm able to and refine the analysis accordingly. After the analysis, I have a planned period of 9 months to complete the write-up and submit my thesis. Thank you for listening. I hope you enjoyed my presentation. Does anyone have any questions?